Dr. Jeff back with you this week with Willow, and this week we're actually going to talk about a real pain in your butt.
A literal pain in the butt. So today we'll be talking about Piriformis Syndrome. So first of all, piriformis is a muscle that's deep in your butt or your gluteal region that works to do some external movement of your leg or moving the leg outwards like this. And within this area we have the sciatic nerve, which is a big nerve kind of the size of your finger, and it runs through this piriformis muscle. Sometimes when the piriformis gets tight or tense, it can actually compress and irritate the sciatic nerve. This can cause symptoms that feel like weird pain feeling in the upper region of your thigh area. So here's a diagram demonstrating piriformis syndrome. So as you can see here, the piriformis muscle, it originates from the sacrum and inserts onto the greater trochanter of the femur. And the yellow cord here in the image would be the sciatic nerve, which originates from the lower part of the spine and combines the nerve roots L4 to S3, and it travels through the pelvis, down the buttock, into the leg. And in this image here, you can see that the sciatic nerve actually travels through and just below the piriformis muscle. And piriformis syndrome occurs when this muscle becomes tight and inflamed and presses onto the sciatic nerve, which irritates it, and this would cause the different symptoms and that funny feeling in the upper thigh and the pain in the butt you may feel.
So we really have to differentiate a piriformis syndrome from a disc issue. Like a bulge disc is going to give you pain in the butt as well, but usually if you have a disc, it's a little more precise. We know exactly where that nerve is going. So L1, 2, 3, 4, 5. You know L3 is going to be here, L4 is going to be here, L5 is going to be here. That's why it might be along your foot. So a disc could look a little bit like a piriformis syndrome, but it's going to act a little bit different as far as where issues are going. Generally with a piriformis syndrome, it's going to be a funny feeling up in here. And again, sciatic nerve is a big nerve, L3, 4, 5, S1, 2, a big nerve. And what can happen with this, and one of the most common causes of this is your SI joint. Your pelvis should shift back and forth. If your SI joint is not working properly, what can happen is the force comes up the leg, it can't go anywhere because the joint's blocked, goes back down your leg and gets trapped kind of in your glutes and your piriformis. And this happens a lot with people who sit too much. So, if you're sitting at work, SIs like to move, and if they're not moving, they get jammed up. So sitting too long at work, going for long car rides, going for long plane rides, that's why we often say when you're going for long car rides or plane rides, you want to get up and move around just to move these joints around a little bit. Another common cause of this is people who do lunging sports. So like me in badminton or tennis or squash or pickleball, we're lunging with that leg, and we are creatures of habit where we're kind of lunging with the same leg all the time, and that piriformis syndrome can get in an overuse just like other muscles. It gets very angry with you, and it gets very tight and can tighten up. And again, that sciatic nerve can kind of go right through or right underneath that nerve and cause an issue.
So if you feel like you may be dealing with this sort of issue or having some weird feeling in the upper leg area or a pain in the butt, it's important to come in to see your practitioner, because if you come in, we can help differentiate between if it's a SI joint problem, and if it is, then the chiropractor can adjust the SI joint. If it is the piriformis issue, then you could see a massage therapist to help release some tension on that muscle, or acupuncture too to help work specifically on that muscle to help relieve some of the symptoms you may be dealing with. You can also use heat to help with the pain, and there's different stretches. For example, the figure 4 stretch, just like this one, works that piriformis muscle, can lean forward. You'll feel a good stretch back there, and a few different other stretches and exercises can be done.
For example, another great stretch would be this one here. So you start by laying flat on your back with your knees bent, cross the leg you want to stretch over the other knee, and you grab the back of your thigh with your hands. You then pull your knees towards your chest, and you should be feeling the stretch in the buttocks. Another stretch here for the piriformis, you'll be laying flat on your back, bringing one knee up towards your chest, and then bringing this knee towards the direction of the opposite shoulder. You should be feeling the stretch up through the outer thigh of the leg that's bent.
Yeah, so if you're driving your car and you kind of have to sit there and you kind of have to wiggle your butt around, because I get that all the time too sometimes, you're getting a comfortable, chances are that's your SI, your piriformis acting up on you. And that's something we can certainly help you with here.
Yeah, exactly. If you feel like this may be something you're dealing with, we'd love to come see you in the clinic. And if you have any other topics or questions about this, please leave them in the comments down below.
And share with your friends, like us, and always here at Goals of Wellness.
We've
We
got your back.